Great. All right. Good afternoon, everyone. Thanks for having me. It's really a pleasure to talk to you today about one of the programs that has come out of our center, the Rural Firefighters Delivering Ag Safety and Health. Affectionately, we call it the RFDASH program. I'll present for you basically a background, a general overview of where the project started, why we formulated the way we did, and then some of the successes and challenges that we've seen along the way. And then I'll try to share a little bit more about some of the other things outside of our one project in our center. I'll start with an introduction of myself. Most people just call me Cap, but I do direct the National Farm Medicine Center, and I am the Deputy Director for the National Children's Center for Rural Ag Health and Safety, as well as the Upper Midwest Ag Safety and Health Center out of Minnesota. Both of those centers are centers for disease control centers of excellence, and specifically in the field of agricultural health and safety. And I'm a social cultural anthropologist by training, so I'm a social scientist. I did grow up on a farm and ranch in Southeast Idaho. We raised barley, wheat, and alfalfa, limousines, cross cows. I rodeoed for 9 years, so I rode bareback horses. I have a little different relationship with risk-taking than some of my safety colleagues. And then I was a EMTB firefighter 1 when I was in college at Moscow Fire Department up by the University of Idaho. So I did get a little bit of EMS training. And so the background behind the presentation today: in the world of ag health and safety, we have a couple problems, speaking in terms of injury and fatality rates. For the most part in ag, as well as many of you know, workers are 7 to 8 times more likely to die on the job than in other professions. And then farms are often home sites, so we have non-working bystanders. So about 33 children are injured every day. About every week or so, 2 children are killed in an agricultural related incident. And so there's a need for injury and fatality prevention on US farms. While there are other entities in industry that would maybe mitigate some of that injury, we really are talking about voluntary acceptance of best practices in the agricultural sector, specifically when we talk about smaller farms or farms in states where there's not, for instance, a state OSHA program or worker compensation programs. And really it is just about how you run your own personal farm. That being said, there is a shortage of ag health and safety professionals. There's not enough ag safety injury preventionists to go around and be embedded in a trusted person in every community. So we started with a basic question of who do farmers trust enough to make changes on their farm in order to have a safer environment. And I don't think anyone will be surprised that farmers said, we trust our family, we trust other farmers. And then in the close third, bronze medal, was firefighters. Firefighter EMS were seen as community members that if they were to give advice in a third party kind of unsolicited way, that they might make changes on their farm. And this is significant because if we ask about extension or safety professionals, OSHA, all those begin to fall farther down the list, and you have issues of mistrust as well as lack of presence in the community. And so with that in mind, we said, okay, there's a lot of great injury prevention knowledge basically sitting on the shelf. We have to translate it so that a firefighter, a rural firefighter, would have a chance to perhaps deliver it to farms in their coverage area. That was the pilot program that led to the RFDASH program, which is now in its 5th year of CDC funding through the Upper Midwest Ag Safety and Health Center. We're going to talk about a little bit more today, but I want everyone to have the background: why ag health and safety, and then why firefighters, and why this idea of a voluntary program. The project team is diverse. We have myself as the principal investigator. We also have Kate Barnes, Kyle Kashalik, our key team members, and then Andrea Swenson does our evaluation. Matt Pills is a programmer. We do have some online and digital tools that we like to use. And then we have the support of folks like Megan Sauer and Emily Redmond as we sort through data and as well as implementing programs. Our external project team, we often call them our master trainers because there is a train the trainer element to the program, include occupational physician Matt Keever from Puget Sound, Dennis Murphy from Penn State, who's an ag health and safety specialist, Davis Hill, who also specializes in ag health and safety, but also in fire and EMS training. If any of you have taken the farm medic program, which I know is well known in New York, Davis was instrumental in that program. Locally, we have Fire Chief Jerry Miner. Steve Brown down at Penn State is also a firefighter trainer, ag health and safety person. And then Jim Caraba, who is the person you can blame for the presentation today. He's the one that asked me to consider making the presentation. So Jim's great out of Cooperstown, and he's one of our master trainers as well. So we have a big team spread across the country to help implement the program. Outside of our individuals, this is a very collaborative project. We wanted to be collaborative from the start. So we worked with Wisconsin State Fire Chiefs Association, Firefighters Association, individual departments that were open to the program, as well as the technical colleges that were responsible for firefighter EMS training. We thought that they would be instrumental in this process as well. And then other farm groups and mutual insurance companies who have a vested interest in preventing fatalities and property loss as well. So we tried to bring everyone together to support the project in the beginning. So as I said before, farmers expressed a willingness to make changes if they were given advice about safety from their fire department. So we want to equip those folks with ag health and safety knowledge and tools, simply because you can be a full-time professional in ag health and safety, and we're asking firefighters who already have a job, perhaps 2 or 3, to take on another one. So the idea of how can we make this easy? And so we've held a number of train the trainer events, including our curriculum, but also how to use the tools that we've developed. So in the original project, we really wanted to focus on the upper Midwest. That's what we were funded to do. And we've trained over 70 fire and EMS trainers in our region here. But as soon as we started training folks here, we started getting calls from places like New York, South Carolina, Ohio, Nebraska, and they wanted to see what the program could do in their area. And so we've trained other firefighters and trainers in other areas of the country. So that's kind of where we're at. That's the status today of who's been trained in our program. You can see some dense pockets there where we had some larger events. So RFDASH as a training module, so not just the community project, but how we actually go about the training, is divided into 5 modules. We condensed the training into an 8-hour day, because we were told that this really does need to happen in a very quick manner. Hotel costs, travel costs, workday losses, those kinds of things. So we try to make it a single day training. And so we spend half the day in the classroom going through PowerPoint slides and beginning to use the tools. And we spend an hour out on a farm implementing some of those and getting some real life tangible experience with them. The 5 modules, we do an intro to ag emergencies, pre-planning, hazard analysis, farm first aid, and then farm community outreach. There's a great video. I'm sure we can share these slides, but that link would take you to a very condensed kind of 3-minute version of what we're up to. What I'll walk you through is basically the modules and what the training goes into. In the intro to ag emergencies, we begin talking about the problem of injury and fatality in the farm community. And we not only talk about the number of injuries and fatalities and those things, we also talk about the economic costs to a community. When a farm has a fatality, it's very likely that that farm will go out of business, and then every business that is linked to the success of that farm suffers. And so we talk about it on a community level, not just an independent individual and their injury or fatality. And as many of you know, when we look at ag injury, it's usually a low frequency, high risk, right? So it doesn't happen very often, but when it does, it's normally a pretty bad incident. And it also doesn't mean that we have a lot of chance to practice of course, with car wrecks and things like that. We're doing that fairly rapidly in fire and EMS industry, so we can do that fairly quickly. But with ag emergencies, you do need to prepare for what may be an incident every other year or so. What we did notice is that when we brought the group together and we asked who's seen an ag emergency or an ag fatality, 1, 2, 3, and then as the career got longer, you would see more of those. But then everybody's seen it, and everybody begins to see the volume in a given community of actually what's occurred on the rates of injury and fatality. So we do that intro to provide context and impact of injury and fatality rates. But then also we talk about what are the main culprits. We talk about tractor rollovers, drownings, equipment entanglement, those kinds of things, large livestock. Zoonosis is clearly an issue now in the COVID era, more recognized anyway as an issue that they want to mitigate. And so we just try to provide this broad context of why this matters and why we need the assistance from fire and EMS. And that's when we also introduce these kind of rates of trust and quotations from farmers that they want their fire and EMS to know what's going on in their farm. Then we move into pre-planning and mapping. This is usually pretty natural for the fire and EMS community. They pre-plan and map big facilities like healthcare facilities and different places like that. But on private farms, they may not have right-of-way. And so really it is voluntary access to those places in order to do that pre-planning and mapping. And the catchphrase we always use here is, if you've seen one farm, you've seen one farm, right? There are different layouts and different intricacies to a farm that an emergency preparedness plan would have to deal with. And so we have a tool that we use to help with that called Farm Mapper. Other programs similar to that include the safety tubes, where you would hide, a farmer would locate a map of their farm in a PVC pipe somewhere on their farm and tell the fire department where it was at when they needed it. But we use the pre-planning and mapping conversation as that's the icebreaker. And we formulate it in a manner that says, this pre-plan and map is meant to expedite our response, improve our response, and therefore the outcomes that come from it, but also protect the firefighter and EMS from injury. And so we really build into the pre-planning and mapping an altruistic attitude from the farmer saying, you don't have to do it for me or do it for you. You can do it for me. Help my firefighters, help my fire and EMS prepare and improve their response and protect themselves. And so that begins the conversation on a kind of symbiotic relationship between the two. From there, as the relationship improves, we talk about hazard analysis. So after we've done the pre-plan, after we've done the map, we can look around and we can kind of figure out what's going to be the major cause of property loss or injury or fatality on this farm. And then we see things like wiring in an old building. We begin to see fuel containers that aren't exactly situated in the best way. We see immobile patients. Maybe they care for someone in a wheelchair, and so we have to know what's going on in that household. We're currently under a tornado watch. Thank you, Kathy. I appreciate it. And so the pre-planning and mapping leads to that conversation about what those hazards might be. Tractors without rollover protection, things like that. So the hazard analysis, again, that's a particular skill set. We have a tool called saferfarm.org, and that's how we get our folks up to speed on what the hazards might be. Safer Farm is a great tool in terms of bringing people along if they're not familiar with ag. The next section is farm first aid. That's essentially a first aid course for people on the farm, things they can do while they wait for emergency response, which will be longer in the rural area, probably with a more severe injury. And so it gives bystanders something to do while they wait and make sure that they make good decisions while they wait for fire and EMS in those scenarios. And the last one is reaching out to the farm community. How do you get buy-in? How do you get farms to really join in? So that's an overview of what we go over for a day. That's a 4-hour piece of the course. Then we go to a farm and we practice the pre-planning and the hazard analysis sections of this. So we've gone over what, this group obviously understands the importance of pre-planning and mapping and being prepared for an emergency. Farm Mapper, farmmapper.org farmmapper.org, I think we have nfmcfarmmapper.com, but I think we also have other domains of farmmapper.org. That's a free service. It's an interactive web tool that uses Esri maps and GIS publicly available maps in order to begin building these maps with different icons to prepare your plan. What I will say about this is it's password protected. So the number one concern with this is what about the data on the farm? Farms are businesses. There are those that would do harm to a farm if they knew where things were. We just got off the phone last week with an extension agent in California, said, you know, if animal rights activists got a hold of these maps, they would cause trouble. So how protected is it? And so it's password protected, and it's on the same servers that we keep medical data on in our facility. So that's important to know. In the beginning, we asked farmers to create the map and then give them and share them with fire and EMS. We've actually switched the program around where we want fire and EMS to do the mapping, primarily because they're the ones that have to use it. So it's better for them to be part of the creation. Second of all, there's things on the map like resources, like where water, a dry hydrant, a landing zone. We added, you know, A, B, C, and D, 1, 2, 3, so that we could do building 1, side B. Those kinds of things that are really specific to fire and EMS knowledge, not the farmers. What this means is you have to have permission and access, but then you do the map and then you probably have to update it. There's one example where we went to a dairy farm that has been a longtime partner with Mapper. We got there to do the training and they had installed a ginseng kiln. That wasn't on the map, and I don't have a ginseng kiln icon. So that's when we use things like new construction, exclamation point. Really critical to this feature is not just the map, but the demographics of the farm operating behind it. So the demographics of the farm include the electrical company, maybe the manure hauler, the mechanic, as well as important demographics of the family and the herd size and things like that. So there's things about the farm in the demographics section of this profile that really are important. When we talk about extrication, those not familiar with agricultural equipment, they might want to have that mechanic on a mutual assistance list because they may know the 2 or 3 wrench pulls that loosen everything up as opposed to a cutting torch. So you can really kind of consolidate that knowledge. So there's a couple features to Mapper. Again, it's free. We've expanded it so that it's available in Canada and have those addresses. And thank you for sharing the link there in the chat. Appreciate that. There's a great YouTube video. Progressive Dairyman did a nice segment on this for their customers. So you can watch that on YouTube. Now, we've done our pre-planning, we've gotten to know our farmer, we begin to take a look around, we think to ourselves, you know, this is probably what's going to cause problems on this particular farm. And operating in the background is, of course, some social science. And I say that because I think it's an important concept that everyone on this call would be interested in or already knows about, which is community risk consciousness. So if we can increase the amount of community risk consciousness, meaning that we understand what the risks are in our community and we work together to mitigate them, we're more likely to succeed. Community risk consciousness was actually born out of big wave surfing. In California, there was an incident where a big wave surfer went out in some really bad conditions. US Coast Guard and lifeguards made attempts. In the process, 2 lifesavers lost their lives and almost a third. And that's when the big wave surfing community got together with Coast Guard and lifeguards and said, listen, we now have 3 families without fathers and brothers because we didn't really understand what the risks were together. And so we'd like to see that same sort of consciousness come together with ag and fire and EMS so that we have an idea that in our community there's a lot of hills and there's a lot of old tractors. That is the recipe for tractor rollovers. Large manure bins going in. If you have a large manure going in, those are higher incidents of well, poisoning and gases, but also drownings. Also that, you know, as you install a new manure, that's not a good, from an aerial perspective, that looks like a great place to land a helicopter. It's not. So coming to understanding about the resources and the layout of the risk areas. Anyway, I say that because that's what we're trying to increase as we go through the process. Safer Farm is a little bit, and hazard analysis is somewhat new in the sense that we're asking fire and EMS to engage in what is critique. It's honestly a critique of things on the farm. Now it's third party, so it doesn't affect insurance rates. There's no OSHA involvement. And so it's third party kind of just good advice, but it's still kind of critiquing things on the farm. So it does take some bravery and some familiar relationships with the farms before we really engage with kind of intense hazard analysis. So we often advocate that you start with different things like easy things like tractor rollover, as opposed to like quality of buildings. Try not to get nitpicky with little things, try to focus on the big things. But Safer Farm was developed out of Penn State. It uses pictures and short descriptions to help a person score a hazard from 1 to 5. And the really remarkable thing is the system works even if you're not familiar with ag, meaning that the pictures and the descriptions are discrete enough and understandable enough that even if you're not a farm person, you tend to score the same as someone who is familiar with ag. It also has a picture taking ability and a mapping feature so that you can do a really comprehensive report. And the report is printable. It creates a PDF. It gives mitigation suggestions. And so you get this free report that you would actually have to normally pay a safety professional to develop, where fire and EMS can provide it. And we have had insurance companies say that they would be willing to consider lower rates for insurance if farms were to make changes as suggested by a program like this. These are all preliminary, of course, but nonetheless, this is one tool to help even if you're not a safety professional or a farmer. The other important point with this one is that they can be printed and downloadable, so that if you have bad coverage for cellular service, we have paper versions of this. So as a research study, we want to pay attention. We have to ask questions, and it's our job as researchers to show this. And so we did social network analysis. Basically, we wanted to say, we want to train these people. Will they take on the burden? Will they take on the extra burden of being a farm hazard analyst? And then will they take it back to their colleagues in fire and EMS and spread the word? And so we did really well with recruitment. We didn't have to try very hard. We filled all of our classes. Everyone showed up on time. These are the classic things with volunteer training. They showed up in spades and they did a good job, and they took it back. And if you look at the diagram over here on the right, these are the folks we trained, and this is what they did with it. They went out and they talked to their colleagues, and they talked to their fellow firefighters, EMS. They talked to their fellow instructors at different technical schools. They went and talked to farm communities and farm organizations, and they talked to each other, and they came back to the core group. This is what that data looks like, meaning that there is a network, there is a call for action that people understand and value, and they will move back and forth and want to get better at it and train each other and come back to the trainer and ask questions. So it's a very engaged network. We also did interviews so that we could kind of hear the stories behind how they were spreading the program and adapting it. Going forward, we're going to be working with a model called the diffusion of innovation model, basically saying early adopters and then mobility, and then the kind of moving here, who's last in line. But right now we're seeing a lot of this early adopters helping us in the early stages of the program. And the World Health Organization really values this model, particularly with implementation theory. So how do you get a program that works moving through a community and accepted? So this is kind of on the research side, but I want you to see kind of what we're working with on our end. As far as the program on the ground, people believe we have a flexible program model, meaning that we don't assume one kind of agriculture or one kind of RFDASH instructor. We assume that there's different folks. We've had trauma preventionists from hospitals join us. We've had nurses join us. And they've been enthusiastic regardless of kind of where they fall into the spectrum. We had a national training where we asked NFPA professionals to come and observe, and they thought we were contributing, one, to NFPA standard 1670, which is the emergency response and extrication, but also the new NFPA standard 1300, which has to deal with risk mitigation, community risk mitigation. So they really felt like we were fulfilling some of the tenets of NFPA 1300 with risk mitigation in those communities. So that's good. What we learned from the people that were really good about spreading the program is what we call a triple threat. So they were in fire and EMS, they were a farmer, and they had some sort of educator trainer role. And we were surprised about how many of these people actually exist. There are a lot of folks who they're a volunteer firefighter, maybe in a battalion, a fire chief in a local community, they farmed, and then they maybe teach either ag or fire and EMS at the community college. So we learned that these are really the people that can spread the program. And we've had a number of instances where they ended up being really key and have moved up the ranks in terms of being asked to do things at farm tech days, rescue training demonstrations, things like that. The media responded really well. Ag media really enjoyed. They thought that their customer and their viewers and their readership wanted to hear about this program. So we had repeated requests from ag media. Related to media, we actually had instances where we had, if you look down here in the bottom right, this is a fire chief who was in our training and then was immediately involved in a roadway fatality a few days after the training. And normally this fire chief avoids the media. He really doesn't like to talk to the news. One, out of comfort, two, out of respect for the patients that he might be talking about. But in this instance, because of our training, he went and did the interview, but he framed it in a way that was completely about how the incident he was responding to was preventable. And so he really took the whole philosophy of the program and showed us that the fire and EMS, when they talk to media, have an opportunity. And so we're going to actually build a media kit for our trainees so that they have good tools and rules about how they should interact with the media in light of training incidents or fatalities or injury incidents as they come into the media. And then we're also searching for programs to fulfill gaps in pre-planning and hazard reduction on farms. We're always looking for new ideas and we're open to them, and that has been part of the success of the program. Obviously we had some challenges, time and resources. These are volunteer, as you get more and more rural, these fire and EMS, they're probably volunteer. We actually target mixed departments, meaning that they have a few paid personnel, just because we feel like that's a level of buy-in and pressure. Oftentimes, if you have county, state, or federal funding, you have to do some risk mitigation in order to secure that. So fire chiefs and administrators in these EMS departments appreciate a program like this. It's akin to things like bicycle and fire prevention, but really tailors to rural communities and gives them something new to do. Regional differences, we can have all the different slides in the world, but we're not going to make Wisconsin slides always make sense for California slides, California firefighters. So it's, there's regional differences. COVID-19 kind of put a halt to trainings. So we're doing a lot more stuff with creating online. You'll see that we're developing a website, but also filming and our training so that they're readily available in kind of asynchronous style. We also learned that during COVID that fighting vaccine hesitancy, these are leaders in the community, and so they're part of the vaccine conversation. And so if fire and EMS have an important message about COVID, they can deliver that. And then they wanted a national network. These are usually unique individuals in the department, not an entire department. And so they want to know who their cousin, who their kin is in the network, so that they can rely on one another and relate to one another and troubleshoot with each other. And you can see there's a number of good quotes here about different trainees and how they've received the program and what they think of now that they've been exposed to the program. So our future efforts, we really had really great trainers, but we're not always going to have them. They're going to retire. So we did decide we need a manual. We need a training manual to accompany the curriculum. We need a development of a website, basically where trainees can come and not only download things, but also talk to each other. The materials need to be flexible. People want to put their fire department on there. They want to put their mutual insurance company that's paying for it. It's probably going to want a spot on the brochure. We understand this. We're trying to create flexibility in the materials, not only for the marketing piece of it to make it kind of sellable to the community, but as things change, ag is always changing. So I'm sure someone's going to want to include remote driven farm equipment if that's what they're seeing a lot of in their community. So trying to be flexible with our materials. And then we want to be able to, like I said, conduct virtual, synchronous and asynchronous training, meaning like we can do stuff live like we're doing today, but then also if people need to do it on their own schedule and on their own time, how do we do that? And how do we keep those materials up to date? And then for us, we have to renew the value of our project with the CDC. So we have to do competitive funding, which is a problem with all research and maintaining and sustainability. You'll see below, we've developed a number of materials and a brand. People got confused by how many players there were in the playpen. CDC, National Farm Medicine Center, University of Minnesota. We had all these names and logos and stuff like that. And they said, you need a unified identity. And so this is what came out of that through different working groups and interviews and things like that, and different calls for materials like posters, as well as brochures and videos. There is a likely collaboration with the Canadian Ag Safety Association that we're going to move this into Canadian fire departments. Again, that's a whole new beast. They have a whole different set of rules and points of leverage for safer farms. But nonetheless, a lot of this stuff applies. So we're working with them. Undoubtedly, we're probably gonna have to translate it into French at this point. So this is other things we're working on. I've gone over this. The idea of scaling up is really, and applying these best practices. This is really what it comes down to, is fire and EMS mitigating life-changing injury and fatalities in their communities, but doing so with tools that make sense and in a manner that they're working with farmers and firefighters, as opposed to other entities that are often kind of critiquing and sometimes in opposition to agriculture, or at least seem to be in opposition to agriculture. So this is our funding acknowledgement. We had a pilot award from the Upper Midwest Ag Safety and Health Center, and then we had a CDC NIOSH award. And we do have a website that goes back to the University of Minnesota website, but eventually will be the autonomous website for the project. So I believe I've used plenty of time, and I want to have plenty of time for conversation as well. Kyle Kashalik is the research coordinator, and we do have a general email, rfdash@marshfieldresearch.org. So I will stop there. And then I don't know if I missed anything coming in the chat. I do have one question about training veterinarians. Yeah, we would happily train veterinarians, and veterinarians have been interesting candidates for other means of mitigation for other problems, such as opioid use, mental health. I know a lot of veterinarians are very cognizant of mental health issues, both in their own industry, but also in the farm industry. And so we have a mental health project actually, where we've done projects where we've trained veterinarians to do mental health awareness with their farm clients. Sure, I can put that screen back up.
It does look like we have another question from the chat. If there are individuals or fire departments that would like this type of training, do they contact you directly, or do they work within a state with their state? I guess if you're not active in that state already.
Right. So they can contact us directly. We have a listserv. We have an entire group, and we actually have a constant contact. So anyone can be added to the constant contact. All you have to do is just share your email. You might even be able to do it through the rfdash.org website. But the constant contact goes out to everybody. And then as a part of that, we have a list of people in different states who have received the training. And we have a really good sense of basically who's really active and could probably supply the training, or at least supplement a training. If nothing else, then we go back to the national level and we would talk about how do we do a training in your area. And this happened a couple times in the program. So New York, a community outside of Syracuse called us up and wanted to do a training. South Carolina's called, Ohio's called, and then so we eventually did a national training, and we brought together basically a fire and EMS person with an ag health and safety person from the same state and partnered them up in a training so that they could rely on one another once they got back. And so that model seemed to work really well. And then we can talk about what virtual training looks like and different things like that. So yeah, contact us directly is the short answer. And then if there's someone in your state, we'll connect you. And if not, we'll figure something out.
Okay, and participants at this point do have the ability to unmute yourself. So if you would like to ask a verbal question, or if you would like to enter a discussion, feel free to unmute yourself at this time. Another question from the chat. Has the Illinois Fire Service Institute participated?
You know, we were in early discussions as we started planning this with Illinois Fire Service Institute, because there's a couple of states where there's really good programs for rural firefighters, and Illinois was one of them. And we have they know about the program, at least a few folks in the program know about it. And we often talked with them when it came to like, where do we plug the program in? And so some people said, well, let's put it in the Firefighter 1 refresher. Let's put it in the EMT refresher. We haven't done a training in Illinois. Would love to. And we definitely happily turn over any of our materials for the Illinois Fire Institute to use. All the stuff is paid for by the CDC, so it's taxpayer dollars that have put it together. So we're ready to share.
From your experience doing these trainings, is there any specific area that seems to come up more than others, that people are interested in either mitigation or in response techniques?
Yeah, I think the people usually, I mean, in the fire and EMS world, they usually gravitate really quickly to the pre-planning and mapping. And so they gravitate towards that. The idea of maps in general, you know, they're good tools. And so the idea of a map by itself is usually a really bright topic. The idea of having a plan. Along with that, and as part of the farm outreach piece, we often advocate that, you know, the farms to approach early on are probably ones that have some worker or a member of the family in the fire department, obviously. And then any of the farms that have volunteered their space for previous trainings, probably pretty good target for the program. And then people talk about this relationship with certain farms because of a high profile fatality or their role in the fire department. We had our host farm in a Minnesota training, for example, was on the county board. And so he was very influential in pro-firefighter, pro-fire and EMS. And so he was known to the fire community. So he was a really good candidate to host the training. I think that when we talk about the economic impact, people get really interested in hearing about what a farm closure does to their community. And they begin to think, you know, in the broader sense of what they're doing when they mitigate injury and fatality. The other piece is we always say that one of the easiest things to do is keep doing your rescue training, but don't forget to do a punctuation at the end of the training about was rescue your first option? No. So as you do rescue trainings, make sure you're providing the means for mitigation.
Could I ask a question?
Sure.
Okay, Ron Britton, I'm working with USDA Emergency Planning in Alaska, and this is an excellent presentation, and I think the module would be really a great one to insert into the local emergency planning committees, as well as the regional contingency plan. And since it's national, it has national application, the National Contingency Plan, which is pretty much oil and hazmat, but the National Response Framework for the all hazards disasters that FEMA manages, under the FEMA regions, there should be regional plans. And this module would be really an excellent fit for those. And as you're developing your training, the APHIS group at USDA has a great deal of training for, you know, some of the what would they call it, wildlife, pets, as well as livestock. And they work very closely with the AVMA, the veterinarians group. And there may be some stuff you can kind of use that's already there and then streamline it, tailor it for your specific needs. I think I've been trying to encourage people to discover the plans that are available locally and see where their program either inserts and or can, you know, kind of cannibalize what's already there to customize it for their own planning purposes. That way there's less creation of parallel evolution planning kinds of things. You know, you can kind of network it so that it fits into a stream of already existing responders that then become aware of your program. But brilliant stuff. Really appreciate your presentation.
I appreciate that, Ron, and I think that the idea of like how do and this is the stuff that comes from some of our trainees, like how do we legitimize or how do we convince the higher ups that we need to be engaged in doing this? And I think the idea of tying them in with regional emergency plans that are pre-existing, one, because they're good and they probably have good resources, but then showing the gaps that might exist for agriculture would be interesting.
Yeah, those plans are already approved. So if you can get that in the next revision, they're on about a 5-year cycle roughly. But if you can then, you know, engage the people and the players that are involved in that, and in their next cycle get it incorporated, there'd be a discussion about the module you've got, and then how it fits in, and whether, you know, it can be used greatly for the regional plan, or whether, you know, there's a lot of stuff from the regional plan that could be incorporated into it. You start kind of coalescing and meeting in middle ground, but their plans are already approved, so you can get hooked up with those. Then then you're in the streamline. Then you're in the emergency response network.
Appreciate that, Ron. That's good. Those are good notes. And I see some other questions coming in. Is fire mitigation a common issue that covered in your program? It certainly is. You know, when we talk about the value for firefighters and EMS, you know, the property loss question is included, and the mapping is particularly tailored to hazards, mapping those hazards, as well as resources for fire response. But then in the Safer Farm tool, there are a number of things that are scored items, things like wiring, fuel storage, fuel on the ground, fire exposures, things like that. So lightning rod, I mean, there's a lot of different things that are included. And it's designed with EMS in mind, as they EMS and farms in mind. So it may not be a mitigation plan, but they are the items in a mitigation plan. And then the next question, is the course blessed by DHS? It is not. It's CDC funded, but that doesn't necessarily mean that we have the blessings from different organizations like DHS and things like that. That would be a goal of the program as we move forward. That's why we started asking folks like NFPA to come in and say, are we on track? And their affirmation that yes, these things start to fulfill NFPA standards bodes well. But I would like to see more of that formal blessing come down from different organizations. One, because I think that lends itself to justifying why fire and EMS do it. Two, it acknowledges that, you know, the safety and injury mitigation and property loss mitigation stuff that's in our program is already evidence-based. Our experiment was a social one. not a safety and health one. Those things were pre-established. So it's one of our goals for sure.
And there was an additional question in the chat. Are there any contacts in North Carolina? Eastern Carolina University has Agro-Medicine Institute, which would seem to be an interested partner.
We do have folks at the Agro-Medicine Institute that are aware of the program. I don't think we have anyone trained in it. We did have a EMT, firefighter EMT in the state who was trying to get a program started. But we do have folks in nearby states that we were kind of positioning for training. But I think there's a number of folks that are ready and willing to partner in North Carolina together to do this. And the Institute would be a great partner. They'd probably be the place where we do the training, actually.
Give another minute. If anybody has any other questions, you can enter in the chat or of course unmute yourself. I would like to say again, thank you for this presentation. It was excellent. I took away a lot of great information. NASAAEP is of course ag focused, all hazards, all animals, and obviously worker safety and fire prevention and truck rollover. All goes into that.
Yeah, I forgot to mention, I wanted to mention specifically our partners in Broken Bow, Nebraska. That fire department came to our national training. We partnered them with the Central States Ag Safety and Health Center out of UNMC. And they actually, the first thing they did was get together with truck drivers in ag and fire and EMS, and they started creating emergency plans for livestock on roadways. And so they used that, and again, they pointed to the fact that we didn't assume that we knew everything about ag in Nebraska, and they were able to fill the model with the issues that they were seeing, and they were seeing kind of a rash of motor vehicle incidents with livestock, and so they immediately tailored it to it.
Most of the comments coming in are thank yous on an excellent presentation. Any last minute questions?
Hi, can you hear me?
Yes.
Hi, this is Will Boyd from the Virginia Department of Ag. I just had a question applying this to larger commercial operations. I know a lot of them have their own internal plans and reaction things to do. But a lot of them don't reach out towards their local first responders. So have you looked at applying this to larger businesses?
Yeah, in fact, some of the farms that are the first to let us on and do the hands-on training are those that are larger, for example. And when I say large, I realize that ag is all over the map, and we can't assume what a big farm is or a small farm. But in the state of Wisconsin, if you have more than 10 employees, then you're susceptible to OSHA inspections. So that I tend to think of them as the larger operations. And they begin to have questions about mitigating injury so that they can lower their worker comp rates. And so these larger farms tend to be the first ones to say, yeah, we get it. What I will say is that there's a divergence in, I'll call it rhetoric. The way we convince people to kind of come along with us. And the first column is the farm that isn't likely to be inspected by OSHA, right? And so I'll just call that the family farm, the small operation. And their change is, again, voluntary for the benefit of, their family and their worker, whatever, what have you. The second category are these larger farms where they do care about OSHA. And we almost need to develop a different way of doing it in the sense that we would want to cite in the mitigation plans and in the emergency preparedness plan how they're meeting an OSHA standard. And that's what a larger farm would be more interested in, because they want to be able to show that they're doing things right. And so, but you don't really want to teach the small town firefighter to talk OSHA, more or less. I think the really important part for those larger operations is how big they are and how big the equipment is. And it's a whole different ball game. And so you may have EMS departments and fire and EMS departments that are not prepared for the level of machinery and electrical that are on these larger farms. And so then we go back to that community risk consciousness, and we begin to say, what does our fire department need to handle if a barn fire for 3,000 cows starts? So it's a really good question. It's built so that it could apply to all sizes of farms, more or less, but how you would train it, I think, would be different. I hope that answered your question well.
Yes, thank you.
All right, well, great presentation. Again, thank you so much for presenting today. We will close this out, and you have left your contact information if there is any other follow-up questions, or if this group can turn into a force multiplier to get more local fire or state fire involved in this project. Really appreciate your time today.
Great. Wish us luck in the renewal. We're gonna try to renew this project going into the fall, and in the renewal, we're gonna focus a little bit more on the ag side, looking at that diffusion of innovation model and making sure that our farmers have what they want and what they need out of the program. Now that we have a good contingency of fire and EMS, but we also hope that fire and EMS group continues to grow. So I appreciate having an audience and welcoming in to the meeting today.
Great. Well, thank you. And I hope everybody enjoys the rest of their day.